There are a lot of challenges. The entire food system, like from the production to consumption. Even though like in Ethiopia, we have made a significant progress in reducing malnutrition, improving diet, but still the production is not diversified. Diet is still not diversified.
In urban areas, we are seeing an increasing levels of penetration of convenience foods, ultra-processed foods, unhealthy foods. So the triple burden of malnutrition is a situation where you have multiple forms of malnutrition. So you have undernutrition, overweight, obesity, but on top of that you have micronutrient deficiencies.
In 2021, as part of the UN Food System Summit, the food-based dietary guideline was identified as one of the game-changing solutions to transform Ethiopia food system. Ultimately, the goal is for better nutrition, for a sustainable food system and healthy diet.
One shared driver of all forms of malnutrition is poor diet quality. Food-based dietary guidelines are here to help shape dietary behaviors to the right direction, to a healthier diet. And it could then lead to increased demand of adequate quality food, which would have then an impact on the production system, the food environment and the like, so affecting the whole food system.
The reason why the multi-sectoral engagement in the development guideline is the most important one is the problem itself is multi-sectoral. It's not one sector problem. It's national-wide problem. And the second one also, when you see the implementation of this guideline, it's also require multiple sectors. It's not only the health sector can implement this guideline. Agriculture, for example, is very important in terms of producing diversified diets, producing environmentally friendly food production. And the education also sector, a very important sector in terms of educating and including the guideline into curriculum. And of course, the industry is also very important. We need to engage industry as well.
It's really very important to hear, the voices and also the ideas and also the practices and also the experiences of wide range of stakeholders to make sure that their views are incorporated in the guideline. We also create ownership from the very beginning as we developed this guideline.
The food-based dietary guideline is evidence-based. It comes from evidence generated within the nutritional sciences, from studies of nutrition experiments, and therefore would inform then programs and policies. So science is at the intersection between the evidence generation and the policy and program implementation.
This guideline is not only limited through the government institutions, but it also helps us to advance various national and also other programs. For instance, the school feeding program at the country level, the menu planning for the inpatient care, the menu planning for big universities, as well as also it also helps us to educate the entire public in terms of the dietary recommendations. So it's going to help us to transform our food system in Ethiopia to have a prosperous, productive, as well as also, healthy citizens.
With the rapid urbanization, with the increase of population, with increased climate-related shocks and droughts, yes, the Ethiopian food system is under threat. But on the other hand, we have the right policies and programs in place to confront these increasing challenges. And I hope that having an adequate and quality diet is not a luxury, it's a basic human right.